Hey there. Let's talk about a situation that came up with another agent that came to me for some help yesterday. It's pretty common, so I wanted to discuss it, okay? So the client is 74 and still working. So he has coverage, okay? Employer coverage, because he works for a company that has 20 or more employees. So he does not need Part B. When you are still getting employer coverage, it doesn't matter how old you are. As long as you have employer coverage, you do not need Part B. And the reason why you don't need it is because if you start Part B when you have employer coverage, you're losing out on that guaranteed issue time, right? So I don't care if you're 80, I don't care if you're 95 and you're still working and you have coverage from your employer, you do not need Part B, okay? And here's the thing, is you're going to get a lot of agents that are going to be like, well, we can compare your private insurance with your employer to Medicare, and you can, get a better deal. But I want you to think about it before you make those decisions. Because number one, you're still working. Most likely, you have a spouse that's younger than you still on there. And in some aspects, you have kids that are still on your plan. So if you let your employer coverage go and move to Medicare, then you have to find coverage for your spouse and children if they're all covered, right? So you need to think about those things. Now, if you're over the age of 65 and you've worked 10 years or 40 quarters, you will automatically get Part A, okay? It doesn't cost you anything, and just because you have Part A does not mean that you have to have Part B, okay? You don't need it. Once you've decided that you're going to go from your employer coverage to Part B of Medicare, there's a form that you're going to send into your employer's HR department. They'll fill it out and say, hey, yeah, Mr. Jones had coverage from, this date to this date. And when you apply for Medicare, you're going to go ahead and send that in with your application, and you avoid the fine, right? So when I was talking to this agent, I asked him, does he have Part B? And he's like, I don't know. Again, we talked about this yesterday. It is very easy for me or for any other agent to get your information. The guy was reluctant, which makes me happy, to give his social security number. So I told the agent, go ahead and make the call with your client on the phone. And when they ask for, the company that we use, when they ask for the social, your client can give it. It literally takes 5 minutes for us to get that information. But, like I said, if this man just gives his Medicare number or his social out to anybody, right, he can basically jack up his Medicare and his guaranteed issue time. He's 74 years old and he's not planning on retiring yet. And so he's going to have coverage from his employer for the next year because he's going to retire at 75. So if somebody put him on Part B now, right, that's going to mess up his guaranteed issue time because he's not planning on coming off of his group insurance until his child is old enough to be off of it. So his child, children can stay on your insurance until they're 26. So when the kid turns 26, they're giving up his insurance and the kid will go off and get his own, and then him and his wife will go ahead and get Medicare. So they'll both be in that guaranteed issue spot, and then they're going to get onto a supplement. But if somebody puts them on, a Medicare Advantage plan now, it's going to mess up everything later for them. Because they're 74, 75 years old, right? And they have health issues. So if they're on Medicare now, when it's time for them to come off of their health plan, they will not, from the health issues that they have, pass underwriting. All right. Now, here's the other thing I want to address that came across yesterday, and I've talked about it a lot on here. There is no reason when you are turning 65 or when you're turning 65 that you need to purchase a Medicare supplement 3, 4, 5 months before you turn 65. If you look on Medicare.gov, it specifically tells you that your guaranteed issue date is a 6-month period from when you turn 65. You can apply for Medicare 3 months before your birthday, the month of your birthday, and 3 months after. It's a 7-month period. That is when you would go ahead and apply for a Medicare supplement. All right, I'm going to say it again, and hopefully people understand it. You do not need to purchase a Medicare supplement before your Part B is issued. Okay, so if you apply for your Part B during that time, the 3 months before your birthday, the month of your birthday, and 3 months after, right, that is plenty of time to apply for a Medicare supplement and have it active for the month that your Medicare is going to be active. Okay, anything with Medicare happens on the first of each month. So if I am turning 65 in April, I have January, February, and March to apply for Medicare for April 1st. Once I apply for Medicare in January, I will have my Medicare number in February, and then it's pretty simple. I can go ahead and apply for my Medicare supplement in February, and it will be active in April. So if you think about it, there's really no reason, and there's really no, you're not gaining anything by applying for it and purchasing it so early in advance. It's kind of dumb if you ask me. All right, it's just a waste. And so if you guys have any questions about any of those things, let me know and we can go over them. All right.